We have talked about the importance of measuring performance and comparing the results to a benchmark to see how we are doing. The healthcare system is so complex, and of course, we cannot measure everything. So you may be asking yourself, where would I start? And what should I measure? To answer those questions, you will need a general understanding of the areas of healthcare services that are the focus of performance improvement efforts. In this module, we will discuss how we go about identifying potential opportunities for improvement. By the end of this module, you should be able to do everything listed on this slide. Most performance improvement projects will measure their performance in one of the following areas: systems, processes, or outcomes. First, let's talk about what is meant about systems, sometimes called structure indicators, as it relates to performance improvement focus. This area deals with the foundation of caregiving and includes things such as the building, equipment, staff, policies. For example, if the facility itself is in good physical condition, it is structurally sound. The necessary equipment is available and in good working condition. As for the staff, an example may include, are the coders credentialed? Though it may not be a requirement to have credentialed coders on staff, but by doing so, it indicates that there is a solid foundation for providing care. Coders who hold a credential are considered to be qualified. In addition to having qualified employees, it is important to have enough staff. The adequacy of the organization's policies and procedures are also considered to be a system or structure quality indicator. Performance measures include process indicators and outcome indicators. A process measure focuses on the way we deliver services that leads to a certain outcome. Measures the actions by which the services are provided. The things people do, for example, conducting a test, making a diagnosis, carrying out an actual treatment. Other examples include processing a request to release medical information. Outcome indicators measure the actual result of care or treatment for the patients. Patient and family satisfaction is also an example of an outcome performance measure. Let's take a look at the 4 steps to identify a performance measure and determine whether or not you are meeting your customer's requirements. The first step of continuous improvement monitoring is to identify the performance measure. This can be done in a number of ways. Processes and outcomes related to the organization's overall mission or important services they perform will become the organization's performance measures. The organization will be monitored by internal and external customers. As mentioned earlier, those areas that are deemed to be high or low volume, high risk, or problem prone may be used by the organization as criteria to identify the performance measure that will be monitored. In other cases, the organization may not be measuring up to other like organizations in the area, and the reasons why may need to be investigated. Lastly, a sentinel event may have occurred in the facility. The Joint Commission defines a sentinel event as an unexpected occurrence involving death or serious physical or psychological injury or risk thereof. Sentinel events usually, but not always, involve significant injury to or the death of a patient or employee through avoidable causes. It describes any variation in a process for which a reoccurrence would carry significant change of an adverse reaction. Examples include suicide, infant abduction, or discharging the baby to the wrong family. Wrong site surgery, rape within the facility, blood transfusion reactions, including major group incompatibilities, meaning you gave like group A to a group O patient, and performing a procedure on the wrong patient. In most cases, it will not be a sentinel event that will trigger performance review. Oftentimes, a process or outcome will be identified that just needs to be improved upon. Once the performance measure has been identified, the customers for the processes must be identified. Our customers are those who receive the outcome or the product. For example, in the automotive industry, many people rely on the car being built correctly. If I worked on the production line and did not do my job correctly, I would cause problems for my coworkers who works further down the assembly line. This person is my internal customer. External customers who rely on me doing a good job would include whoever buys the car, in addition to the car dealership, insurance companies, and anyone else who may be impacted by a defective car. In healthcare, even though we are not in the manufacturing business, we still produce products and services for both internal and external customers. Let's say we are going to monitor our coding accuracy. We would identify those who rely on the coded data. Our internal customers may be those in the billing department, and the patient and insurance company would be a few of our external customers who rely on the diagnosis and procedures being coded correctly. Depending on the process you are monitoring, your customers may also be the patient's visitors, physician, accrediting bodies, or other healthcare facilities, just to name a few. Next, you must identify what the customer's actual requirements are for determining what factors the customer values. This is easier said than done. Remember, you must determine what the customer requires, not what you want or what you think the customer wants. What you may feel is important may not be important at all to your customers. There are several ways to identify what is valued by your customers, and we will talk more about how we do that in later modules. Finally, ask whether or not the outcomes of the current process actually meet your customer's requirements. If the answer is yes, if what you are doing is meeting the customer's requirements, the organization would not have to form a performance improvement team to examine that process. But you would want to continue to monitor the process just to keep an eye on things to make sure you are continuing to meet their requirements. If the answer is no, and you are not doing what your customer values, a performance improvement team should be formed to examine the process in greater detail. Let's walk through an example of using the four-step process. In this example, we will look at the registration process in the same-day surgery department. In this case, we reviewed the customer satisfaction surveys that our patients have filled out and returned to our hospital. There has been an increase in the number of complaints about the number of times they had to come to our facility to complete their pre-op testing prior to having outpatient surgery. We're going to take a closer look to explore the problems identified. Identify all the customers associated, identify the customer's requirements, and determine whether or not the customer's requirements are being met. In step 1, the performance measures identified were registration information provided and surgery scheduled by a physician's office, and the preoperative workup completion. In step 2, we identified all of the customers associated with the process. Our customers included the patient and their family, the physician, and the physician's office staff, the surgery staff at our facility, and our registration staff. In step 3, we must identify the actual requirements for each of our customers. We determined that our customers want to take care of all the registration information needed at one time. It was also identified that all of their pre-op testing must be completed before the day of surgery, and this should be coordinated in one visit. Now that we know what our customers require, we must see if our customers' requirements are being met. The information we found is listed on this slide. As you can see, our customers' requirements were not being met. The data collected process indicated patient dissatisfaction with services. Several problems were clearly identified that could lead to an improved outcome for patients throughout the performance improvement process with a combined team approach. This is an example of outcome as a performance measurement. This slide recaps some of the topics that we have discussed. We had also talked about structure measurements, but most performance measures will either be process measures or outcome measures. Process measures how you are performing a process, and outcome measures your results of the process or function you performed. Benchmarks are important because it is a systematic comparison of one organization to a similar organization. You can see how you are doing. We also talked a little about sentinel events. Sentinel events are those events that cause or have the potential to cause death or significant injury to a patient or employee and could have been avoided. Those must always be investigated and hopefully prevented in the future. To improve performance, it is important that you collect, measure, analyze, compare, and display your data. To do this, there are several tools or techniques that you will need to learn how to use. You will not use every technique for every step, but just like any job, you will need to know when to use the right tool at the right time. A few of the most common techniques used to determine performance measures: identify customers requirements, and identify whether customers' requirements are being met, include brainstorming, affinity diagrams, and the nominal group technique. We will talk about what these tools are and how they are used in the Quality Improvement Toolbox presentation in this module.